A health survey carried out in 21 districts and 47 health facilities by the Action for Health, Human Rights and HIV and AIDS highlighted a number of major difficulties, including lack of access to condoms accounting for 68% compared to the Ministry of Health reports at 78%. This is partly responsible for the escalating HIV and AIDS infections, as the prices of condoms are too high, especially for the rural people. And more worrying is the fact that only 2% have access to female condoms, which is due to lack of sensitization on usage in communities and in addition to inadequate tuberculosis services.
Issues of TB treatment is still a big problem. Diagnosis is still at 30%. Treatment is at 34%. Overall, you just find that it's only 45% of people who are living with TB accessing the service.
The report also highlights the prevalence of non-communicable diseases in the country like blood pressure, cancer, diabetes, which are increasingly becoming a health burden to the nation. According to health experts, this is due to lack of a non-communicable disease national policy, which has compromised resource allocation and prioritization. This has mainly affected people in rural areas who lack access to quality health care that has resulted into high maternal mortality, infant mortality that are claiming thousands of lives.
Currently, our government is not actually even having a policy on non-communicable diseases. So you wonder, for all these many years, what intervention strategies are being implemented in this country to be able to address NCDs.
Health experts are calling on government to allocate Ministry of Health a reasonable budget to addressing the unmet need for HIV and AIDS treatment and neglected interventions of non-communicable diseases.
Let us make sure that we continue every year improving on the funding. You know, if we were 8%, go to 9%, 10%, and you go, even if it takes some years. But
over the years, politicians, health experts and even government officials at different forums have called for increased funding to save lives of Ugandans who lack access to quality health care. But nothing has to date been achieved, forcing many to think that there is simply no political will. Shamim Bataliwo, WBS News.